Hello everyone, this is Chadi Alraies from SCAI 2022 in Atlanta. With me is Dr. Michael Migueli. He is currently a chief fellow at Henry Ford and recently has an interesting paper that looking into the heterogeneity of outcome and CTO between RCTs and registry. Dr. Migueli, thanks for being with us.
Thank you, Chadi. It's a pleasure to be with you. We were interested basically in the differences of the quality of randomized trials assessing CTO PCI, which is a hot topic all the time, and we decided to compare the characteristics and outcomes of those patients enrolled in RCTs to real world practice and what we see every day. So we performed this large systematic review, meta-analysis. We collected all randomized trial patients and we analyzed their baseline characteristics. We also got most of the big registries in CTOs. We divided them actually into national registries, which includes everybody, and dedicated CTO registries. And on comparison, what we found is that only 6 randomized trials present in CTO PCI that compared patients to CTO PCI versus medical therapy, including about only 1,000 patients. This is where we gather all our data and all our recommendations from, only 1,000 patients. And when we look deeply into these patients and compare them to what we do every day, we found that these patients have way less comorbidities than the patients that we are seeing everyday practice. Comorbidities were less, the length of CTOs was shorter, and JCTO scores were less compared to those in registries, either dedicated registries or national registries. And outcomes were kind of comparable between the RCTs and dedicated registries. Actually, adverse outcomes in hospital were higher in RCTs, which we attributed to 2 things. Either we underestimate complications in dedicated registries, or the operators have a tendency to push for success in RCTs. It's either or. But overall, the lower comorbidities, more favorable CTOs were definitely seen with RCTs. They are not representative of real world practice.
So one thing you mentioned about the difference in RCTs, but RCT has been a while since it's renewed, and now registries, you have more options, more wires, more techniques that is more kind of real world and more contemporary compared to RCTs. So maybe that's why the success rate was higher in the registry?
Yeah, absolutely. Registries are always updated. We always have data. And again, we're not bashing RCTs at all. It's the highest quality data, but even if we look at the 2 biggest RCTs that we have, and everyone knows this, both were stopped way early before they achieved their power because of difficulty enrolling patients because of their symptoms. So the goal of our study is just to put things in perspective, like understand who are the patients that we're treating, who are the patients that are in RCTs, and understand there is a difference, and more data is definitely needed.
Absolutely, yeah. Dr. Migueli, thanks so much for your time, and congrats for the paper. And nice to see you at SCAI 2022. Hopefully next year we'll see you as well. Please watch this video and others on SCAI-TV. This is Chadi Alraies from Atlanta. Thank you so much.
Thank you.